I'm going to address, which is always overlooked, okay, which is always overlooked, that is your mental health. Physical health is very much necessary, but side by side, mental health is also, it should be looked for, okay. So for that, you are your own doctor. You have to treat yourself because no other person can treat your mental worries. You are the best judge of yourselves, okay. So people, they should, at your level, they should enjoy their relationships with family members, with friends and others, and you must learn to live. Okay, that is very important issue. You must learn to live a healthy life and work without mental breakdown. Okay, and not only you should must not only a physically healthy person but also a mentally healthy and psychologically stable personality. And on the way of your academic career, you will have a lots of academic and career related stress. So in that case, you have to be positive and take the challenges sportively. Okay, and enjoy your college life because this is a very vital part of life. In our days, we used to enjoy our life. Now we start missing those days. Okay, because college life, each and every moment you must enjoy. Okay, and at this tender age, go for friendship, but don't opt for any committed relationships. Okay, because this type of commitment, it gets washed away with time, and it gives you lot of mental worry. So now this is the age for your career building. Now this is not the age for other things. Okay, everything will come running after you once you are very much okay stable in your life. Okay, so in that case, don't forget this word, and share your personal problems with your close friend as well as faculties. Okay, because in a professional college like yours, that your mentors or faculty who are associated with you for teaching learning procedure, so they will act as a mentors, and they act not only as a teacher, they act as a friend, guide and philosopher. So in that case, share any mental worries and happenings which comes to your mind to your faculty, so that they will try to means help you out from these situations. So that was about the mental health. So which is must most of the time it is ignored, but this is very important part of the life, especially at your age group. Okay. So don't be depressed, and you have to be very positive, and you have to be very confident. Okay, until you build up the confidence in yourselves, you cannot go ahead because this is a long journey. This is just the beginning only. Once you come out from the college, professional college like that, then you have a lots of other things to do. You have to settle in your career, everything. Okay. Now, next, very important issues, health issues nowadays also, which is very much prevalent. I am coming to that. So that is regarding the acute respiratory infections and severe acute respiratory syndrome. Okay, acute respiratory infection. Many of the times, you had from your childhood. That is commonly known as flu. Actually, this is a viral infection caused by influenza virus, okay, Haemophilus influenza. Now, in that case, in your childhood days, you might have vaccinated by Haemophilus influenza vaccine, HIV vaccine, but still, the virus is like that. It changes its pattern, genetic makeup. So in that case, you have lots of strain, new strains. So it is a seasonal type of disease. So in each season, at the coming winter days or in extreme summer days, also sometimes you have few bouts of this common cold. Okay, that is a flu-like syndrome. It is called acute respiratory infection. So in that case, to prevent that, you must have a respiratory hygiene, like you use mask, do not cough or sneeze openly, use handkerchief, and if the handkerchiefs is not available, your mask is also not available in the class setup or in the practical room, in the workshop, etc. Sometimes you feel like coughing and sneezing. So in that case, you should guard with elbow to prevent the things comes out in their sneezing or coughing. Okay, how to guard with the elbow? This is the procedure. Okay, so whenever you have you like to sneeze or something, if you the other staff is not available with you, so you must guard with things with your elbow. So this is applicable for to prevent the COVID also. Then this how to be get treated with this situation. So first of all, in your, as I was mentioning, that you must have the tablet paracetamol 650 milligram in your first aid box. So you have fever is like feeling body ache and all. So you take one paracetamol tablet after having meal. Then you may have the nasal decongestant sprays also nowadays available, like Nesivia and Otrivin, etc. So you can have that also with you. So sometimes if there is nasal blockage, sneezing, etc., so you can use this nasal decongestant sprays. Now, if this acute respiratory infection it gets severe, then it turns to SARS, severe acute respiratory syndrome. So it is a communicable viral disease caused by new strain of coronavirus. So SARS, it is highly associated with the COVID infection. It is known as severe acute respiratory syndrome. Now I am coming to that topic which we are eagerly waiting for to discuss, that is COVID. Okay. So what is the full form of COVID? Anybody? Any one of you? We mentioned last 1.5 years, we are mentioning COVID, COVID and COVID. What is the full form of COVID? Hello students, I believe you are not sleeping here. I thought COVID is a what? Yeah, of course. But what is the full form? So you are not going with the media? All of you are busy with other things? Somebody is telling coronavirus, but the term is COVID, is not it? So there is a full form for that. Anyway, I must not waste much time because time is limited. So that is, yes, Shaptak Mandal. You want to say something? Yeah, coronavirus disease. Very good. Coronavirus disease. And when it was first detected? It was first detected in the Wuhan city of the China in December 2019. So from that December 2019 till now, we are fighting with this disease, a highly infectious disease, and it is caused by a virus known as SARS-CoV-2. Okay, what is the full form of SARS-CoV-2? Severe acute respiratory syndrome coronavirus 2. So that is the causative agent for this disease. So the disease is known as COVID-19, and the causative agent, that is a virus, it is known as SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. In different languages, and it is a location-based surveillance act. Location-based